Dr. Garima here again, and yes, let's solve another question of Australian Dental Council exam. Many things were going on, so I could not shoot a video, but now many things are sorted out, so I can shoot a video, so I am doing one. For the March 2025 candidates, wow, it's 2025. Yeah, whenever I just write on a paper 2025, I feel, oh my god, it's like, there was a time when we all were like in 2000, and it was a very fancy stuff because we all went into another century, and now it's already 25 years since then. Yeah, I'm old. So anyways, so for all the March 2025 candidates, your exam is on 18th and 19th, so few days remaining. It's 4th today. Buck up, revise. And for all the new candidates, this is what a question of exam looks like in the exam. So these are all past paper questions. Let's just solve directly and not waste anybody's time. A 9-year-old child was brought to you by his grandfather for examination. Age is very important. 9 means he's a minor. His grandfather says he's been experiencing pain in the upper right part of his mouth for a few days. Okay. The pain was on and off. Now this is very important. On and off pain, not a continuous pain. Of short duration. Again, a very important symptom. It's not a lingering pain, and especially triggered by sweet food. So there is a trigger, which means it's not spontaneous. Basically, I'm trying to see whether the tooth will be having a reversible pulpitis or an irreversible pulpitis. Now all these three things, the on and off pain, the short duration, a trigger present, belong to reversible pulpitis. An irreversible pulpitis will have a continuous, spontaneous, lingering, sharp shooting pain, correct? With hot and sweet food and without food as well, especially night pain. So whenever you're reading a question, I always tell you, and the reason I repeat this in every video is that I want to change the method in which you think, because only that change in your mind will make you answer the question correctly. If you don't change your thinking, you will keep making the same mistakes and you'll keep wondering, why am I failing in the exam? You understand? So repetition is so that the information that I'm giving you is assimilated in your brain and you change the way you think. You understand? That's why I keep repeating, focus on the keywords, think laterally, see what the question is trying to tell you. All the answers lie in the main scenario itself, honestly. No relevant medical history, great. No abnormality detected extraorally. Intraoral revealed no radiographic abnormality as well. That means there is no extra or absent structures. What is? If there is caries, there would be caries. If there is no caries, there wouldn't be any caries. Understood the question? A 9-year-old is a minor. He's visiting with the grandfather, not the parents. So somewhere this question is going to ask you for a consent. That's why they mentioned the grandfather. Think, predict, be ready. Based on case history only, what's your diagnosis? So if today a patient calls me up and I've not checked, or I just enter my clinic and I start talking to my patient, and if we give this history, immediately my mind is gonna go, okay, probably there is a cavity, and that cavity is very close to the nerve, but because there is no night pain, there is no spontaneous pain, there is no lingering pain, it may not be an irreversible pulpitis. It can be a case of a deep cavity. This is the first thing that's gonna reach my mind. But without getting biased, I will still go and examine with an open mind. But based on the case history alone, my diagnosis would be acute reversible pulpitis. It cannot be irreversible, otherwise it would have been a sharp shooting night pain. Apical periodontitis will not be triggered by sweet food. It would be just there. Dentine sensitivity, again, it can be there, but the symptoms are more for pulp. In dentine sensitivity, it should be there with air as well. It should be there with water as well. But since that is not mentioned, I'm just gonna go with acute reversible pulpitis. Plus one more thing, dentine sensitivity would be there generalized. It shouldn't be just located to one area of your mouth, especially in children. In adults, yes. because in class 5 cavities, or when the root is exposed because of the recession, even the tooth is fine, you still feel sensitive, but then the patient will specifically say that whenever I try to rinse my mouth with water, it hurts. You understand? Now, on intraoral examination, you found out that the tooth has a cavity with a marginal ridge collapse. What's your emergency treatment? Emergency treatment. See, this is where most of the people make a mistake. They just see the tooth and they feel, wow, let's the treatment go for either a pulpectomy, or you do something else. RCO opening, that's what we usually say, that we open the canal, is another term for pulpotomy. You understand? So if the nerve is inflamed and the marginal ridge has collapsed, for sure that cavity has penetrated the pulp. Now, in children, the pulp chamber and the pulp in the roots, you can compartmentalize that. It is very, very possible to just remove the top portion of the pulp in deciduous teeth and let the pulp in the roots be there. Unlike in adults, because in adults, if the pulp is affected, it is affected. It cannot be just generalized into the pulp chamber or the roots unless it's a traumatic exposure. But here, a caries exposure is there. It's not exposed actually, but the caries is present close to the pulp, and even when on IOPA you see caries is touching the nerve, it's a deciduous tooth, and if the symptoms are not of spontaneous sharp shooting pain, you can still just remove the pulp from the chamber. Anybody who's deeply interested in understanding more about this kind of pulp nature, please read Seltzer, Seltzer, the most beautiful book written on the pulp. It is very nice. I swear it's not boring. This thick, Xerox it from your library. Get it. You'll fall in love with it. You'll understand better. You'll understand dentistry better. So anyways, so emergency treatment. That's the most important keyword. I would do a pulpotomy, and then later on I will do my fillings, or I will give my final restoration. But I would do a pulpotomy for sure for this case, not pulpectomy directly, because it's not showing signs of irreversible pulpitis. Neither on the X-ray it's mentioning that there is some internal resorption mentioned. Extraction is an option, but then once you remove the tooth, you remove the tooth. I want to save my tooth. Coronal composite filling, well, that would be later on. I have to treat my pulp first because the tooth is showing some symptoms, and that's why the patient is with you. Root canal treatment is basically pulpectomy. So, which final restoration would be most suitable in this case? Final. Look at the keyword. SS crown. Always in children, you do a pulpotomy or a pulpectomy, you have to give an SS crown. The tooth really becomes hollow, and it's a very small tooth. Wow, a lot of ambulance noise is coming. I hope everything is fine. Compomer, amalgam we don't use in children. I mean, actually nobody uses amalgam. But yes, you will have to give your part 2 exam on amalgam, because in some parallel world, apparently Australia thinks that you will be doing amalgam, so you have to demonstrate that to him. So, zinc oxide eugenol would be as a base if you want to give, but that would not be a final restoration. Final restoration, always a stainless steel crown. Nowadays there is a big fad of giving zirconia crowns. You can give that if the patient wants, but stainless steel crowns are the gold standard. The patient presented with his grandfather who was living next door, who can give consent to commence the treatment for the kid. Remember in the starting of the question I said 9-year-old minor grandfather, somewhere a consent question is gonna come. No consent is required. Not possible. Any patient that walks into your clinic has to give a consent, either himself or if the child is plus 16. Yes, but you will not proceed without consent for anybody. So that is out of question. His grandfather. Now, unless the grandfather is a legal guardian, he cannot. If the parents are alive and the boy stays with them, they only can give the consent. The kid only cannot, because he's not 16. The dentist, provided his dental nurse agrees. Oh no, the dentist cannot give a consent. Only mother or father can give consent for the treatment. Yes, yes. And start establishing this practice, please. Like, keep proper documentation. You never know how sweet the patient may be. He's not your son, he's not your father. He can screw you anytime he wants to. So please take a consent. In Australia, the following materials are applied for amputated pulp tissue during vital pulpotomy, except, that means all the answers are correct except one. Now these kind of questions will always be marked questions because they will have only one answer, right? So do not make a mistake in such questions. There is only one right answer, it means it definitely would be a marked question. By now you should know that there are 40 unmarked questions in the exam, which means that out of 280 questions you will be marked only for 240 questions. You will be judged basically. The rest of the 40 questions, you mark them right or wrong, will not be counted. Why is that? Because those 40 questions can have more than 2 answers correct. Yeah, that's how it is. I feel it's unfair, but it is what it is. So what's the answer here? It's formocrozole. Formocrozole is a good material. I still use it. Many people use it. But in Australia, they don't prefer using it for whatever their reasons. So follow that because you're answering in that particular country. For some other country, if they're using formocrozole, then formocrozole becomes the right answer. For me, the following materials are applied for amputated pulp tissue during vital pulpotomy except. Now here, this question, you have to be very careful. It doesn't say deciduous tooth or a permanent tooth, right? Now if it was a deciduous tooth, then for Australia I would choose formocrozole, but I will also choose calcium hydroxide. You will never put calcium hydroxide. It's contraindicated in deciduous teeth. Why? Because it will result in resorption. I've explained this time and again, and still, no matter how clearly it is written in every standard endodontic or pediatric dental book, people still would make a mistake. Calcium hydroxide is contraindicated in deciduous teeth. Why? Because it will cause direct resorption of the tooth, internal resorption basically. Why is that? Again, read Seltzer, but I'll give you a gist of it. In a very simple layman terms, take calcium as a friend of pulp, okay? Now in deciduous teeth, what does the pulp want to do? It wants to resorb because the tooth has to fall off. So there is always more of odontoclastic activity which is going on. Now, calcium is a friend of pulp. It will do whatever the pulp will ask it to do. Now if the inherent nature of the pulp in a deciduous tooth is to resorb, calcium hydroxide will help you with that. Now take the permanent tooth. The permanent tooth has to stay in the mouth for as long as it wants to. The pulp always have a regenerative capacity in the adult tooth. That's a permanent tooth. More of odontoblastic activity. So now if I give its friend to it, that is the calcium hydroxide to the pulp, the calcium hydroxide would help in repair. So the same agent would do whatever the pulp is asking it to do. Now if I apply calcium hydroxide in a deciduous vital pulp, it will resorb and it will create more of a problem for me because I don't want the tooth to resorb so early. I'm fixing that tooth to stay for whatever amount it has to stay in the mouth. You understand my point? Please write this down, highlight it. Calcium hydroxide is contraindicated in deciduous teeth. But how smartly the 5th sub-question is clubbed with the deciduous scenario to trick your brain. Now if you would not read this question properly and assume that this is related to the scenario, which it is not, you would use calcium hydroxide and will mark it wrong. Because this question clearly says, in Australia, the following materials are applied for amputated pulp tissue during vital pulpotomy except it doesn't mention deciduous tooth. So you have to consider they are asking for a permanent tooth. No matter how much you think or your mind is getting tricked, the answer is formocrozole. You understand that? And you will get plenty of such questions and scenarios as the last sub question. And because you will be still thinking about the scenario, they would ask a basic dental question in the midst of it and you'll mark it wrong. And then you'll wonder, the paper was easy, why did I still fail? This is because you failed, because you were not vigilant, you were not mindful. How will you become vigilant and mindful? By practicing the mocks daily basis. Solve 5 questions daily, if not more. But if you don't practice, you're bound to make a mistake because you will be under pressure in an exam. The timing is very short. You'll have a deadline and you'll have all new questions. You won't be relaxed and free like you are right now. So only when you have practiced, you have trained your brain, you would attempt very nicely. And this is what all of my students have told me who have passed in one shot. No matter they are recent graduates, they are practicing clinicians, they are working people, or they have taken up studies after 10 years of their graduation, they all tell me, we changed our thinking the way you asked us to and we cleared our exam. As simple as that. Understood? So yeah, for newcomers, how you can get access to all the books that are needed, go on Target ADC Facebook group. You have to send for an approval, I will accept it, and then you have an access to my Facebook group. Recently I've seen 4 or 5 other fake people have made the same name, Target ADC, but you can find mine by seeing the number of people who have joined. It's 5,000 plus. I don't know why people do this, why they want to fake and try to capture candidates' attention by wrong methods. But anyways, you people are smart, you'll figure it out. If you want to email me asking more about the course that I take for the Part 1 exam, please do so. It's adcwrittenmocktest at gmail.com. I will share the link, the email address in the bio. One more thing, what I was gonna say. Yeah, for all the new candidates again, I do not conduct online classes. I have been asked this question so many times, and again I repeat, I'm not teaching you dentistry. This is not a dental school. You're supposed to know your subject. You don't know your subject, I can guide you from where to read. I cannot teach you. I will solve your doubts. Yes, I'm here for that. Once you get enrolled with me, all the candidates who have enrolled with me, I answer their doubts on a daily basis. It takes up my 1 hour, but I'm happy to do so. I cannot teach you dentistry, so there are no online classes. The only thing is you have to read and solve the mocks, and you'll become confident yourself. So that's about it, and hopefully everything is going fine in all your lives. And yeah, I also wanted to discuss one more thing. Recently I got an email and that person was saying that I'm really desperate to clear my exam and I have a small son. Give me all the materials that you have, I'll pay for it, and I just want to clear the exam in one shot. See, if you're going to go with that mind attitude, you'll go under depression, because first you're going to stress yourself out thinking I have to clear, what if I fail? That is not how it works. I understand clearing the exam is very important for you, but you also have to understand that the exam pattern is not a transparent one. It is very blurred, it is vague, and you will never know if you failed why you failed. You'll never know your mistakes, and it's not a percentage, it's percentile. So it all depends on how others also perform with respect to you. So take this exam as a journey. Do not stress yourself out. Don't put yourself in a situation where you have to stress yourself out. To all those girls who are just going to be graduated now and getting married off to Australia, and then they think we'll go there and give our exam and then clear, please have a backup plan. You may not be able to do so. And I have seen when I was myself in Australia, people were appearing for the 5th and the 6th time, and they were literally going under depression because so much of amount is spent and you just cannot do any other job. You're either working as a dental assistant or doing nothing at home. Clear your exam from your own country. Part 1 is conducted in various parts of the world. Go, give the exam. Part 2, just fly to Australia, give part 2. Once you clear, then migrate to Australia. So at least you're working where you're working and you're not stressed out. You have your family with you. But anyways, you think, what is the best for you. I mean, this is what I would do, this is what I was doing. So, and it did stress me out. Yes, there was hard work involved. Hard work will be there, but you're not stressed out. So, don't go with that attitude. Like, just be prepared for anything. But regardless anything, it's not a waste of time. The part one is very nice. I really like the part one format of the exam because it does make you a better clinician. You read so much, you understand so much about the scenarios. So anyways, have a nice day. I'll leave and I'll do my other work. Bye.